Jenny is 16 and has a diagnosis of anorexia nervosa. This can cause serious harm, including death. She is being supported by the local community-based Children and Young People's Eating Disorder Service for 12 months. During this time, she's had multiple hospital acute admissions. Recently, Jenny has begun to go to extreme lengths to lose weight. She is severely restricting her food intake, hiding meals, and obsessively exercising. She'll often say she feels her inside voice calling her fat and she hates herself. Lately, she's been locking herself in her room and engaging with online communities. She feels these are the only people who understand her. Jenny denies having any knowledge of these communities when asked. Recently, she's been experiencing physical symptoms. Her hair has started to fall out, she's missing her periods, and is feeling weak and dizzy. Today, she fainted whilst walking up the stairs. Her girlfriend saw, and given the frequency of these incidents over the last few weeks, she calls Jenny's mum because she's concerned. Mum calls her eating disorders case manager to let them know about the fainting, that she's struggling to get her to stick to the meal plan and is worried about her. Around mealtimes especially, Jenny's inner voice tells her to not listen to Mum, and if she eats, she is going to become fat. Jenny's eating disorders case manager has arranged an urgent appointment with a paediatrician after Mum reports the fainting. During the appointment, they weigh Jenny and identify potential physical health concerns, which is essential. This is achieved by following the Medical Emergencies in Eating Disorders, or MEAD, guidance. She is admitted to a paediatric ward and staff can see she's lost weight. Her physical observations are worrying. She has a low pulse that jumps when she stands up, her blood pressure is low, and her periods have stopped. They administer a nasogastric tube because she is refusing to eat any food and needs essential nutrients. Her paediatrician requests blood tests, and they discuss next steps with the multidisciplinary team, including a psychiatrist. Jenny is now physically stable, but she is not complying with her treatment. She's removed her nasogastric tube. There are concerns about her mental health, and because she's already accessed the intensive community offer and had multiple acute hospital admissions, it's agreed she should receive support for this in a mental health hospital setting. Jenny is asked if she is happy to go voluntarily to the Children and Young People's mental health inpatient setting, also known as Tier 4 CAMS, for an inpatient stay. She replies no. Mum is conflicted. She feels this is the right decision, but she has reservations. The local eating disorder service has asked for a consultation with the regional eating disorder service to review the support they've given and consider and agree next steps for Jenny's treatment. The team then assess her on the paediatric ward. They offer a comprehensive review of all previous interventions and believe she lacks the capacity to consent to be admitted to a Children and Young People's mental health inpatient setting, recognising that her nutritional deficiency impairs her cognitive decision-making. They conclude that she is mentally distressed through her eating disorder, and therefore mental health hospital provision would be necessary. So a Mental Health Act assessment is undertaken by 2 doctors and the approved mental health professional, known as an AMP. Members of the mental health inpatient outreach team join them during this assessment and accept the referral. Jenny is detained under the Mental Health Act on a Section 2 for a period of assessment for up to 28 days. This is then converted to a Section 3 for up to 6 months because of the need for further treatment to improve her mental health. After 3 months, Jenny's condition started to stabilise and her Section 117 aftercare planning commenced. The Section 117 aftercare duty is coordinated through a responsible clinician and takes a multi-agency approach with clear roles, responsibilities and funding considerations to ensure continuity of care and effective community support, with Jenny's wishes at its heart.